Welcome to the second episode of Adventures with Anxiety and Depression, or Anxiety and Depression Adventures, which I think is what this channel is labeled as. Thank you for coming back. I appreciate the folks that have already viewed the introductory video, though it went a little longer than I expected. But I wanted to very quickly get back to you with our second installment. And this one picks up where the introduction left off. If you recall in my introductory video, episode 1, really the key tip I left with you is that if you are feeling substantially different, either down in a sort of what we would generically call a depressed state, or you are feeling overly anxious, more so than usual, and in both scenarios, these are lasting longer than just a couple of days. This is going on for weeks, either triggered by an event that you're cognitively aware of, or if it's just happened. It can go either way. So, as I said, the key thing is get help. Get professional help. Don't start second guessing on the internet or from friends, or whatever. The thing is to get to your doctor, and usually the first step is your family physician. So I'm going to pick up from there. And again, all of these episodes are purely what I have been going through for over a dozen years, and continue to go through myself. Challenging and difficult as it can be, it is an adventure, and I put that on there on purpose, because as painful as any mental illness is, the stigma associated with it, the self-doubt, the lack of knowledge of what the heck is going on, which is probably the worst of it all. The key thing is you have to start on what I choose to call as an adventure. And it's because if you allow yourself to fall into the pit of negativity, that definitely is not going to help you. I'm not saying this flippantly, believe me. I've been in the pit. I'm kind of halfway in the pit at the moment, but nonetheless, we have to take life as it comes and ride the wave, and utilize our friends, our family, our physicians, and probably at the end of the day, most of all, ourselves. So, you're not alone. Now, today's episode 2, I've labeled medications. And I am not a doctor, as I previously mentioned. I can only speak to my own experience, and believe me, after 12 years, of getting medical attention, both from the mental health system as well as from what I'll just simply call the physical health system. I've been through the pharmacy. I have been put on probably at least 7 to 10 what casual people would call antidepressants. And if I'm pronouncing this correctly, often they act as anxiolytics or something of the sort. Basically, they help with anxiety just as much as they do with depression. And in my case, it's been more anxiety driven, but it doesn't take much to flip the coin over to depression, and then you're dealing with both. Anyway, what will often happen, just from speaking with friends of mine and from my own experience, is you will be surprised that your physician will be rather quick to suggest that you go on an antidepressant of some sort, assuming your symptoms are similar to what mine were and have lasted as long. Antidepressants are broken up into many, many different categories, and they've been around for decades. They've been refined very, very well over the years to reduce the side effects, which you need to be aware of on these medications. And they can be very helpful. The kicker is in my opinion, and I don't mean to be sarcastic or speak ill of those who they have helped, is for frickin' sakes, why do they help everybody else but me? It's something I've spoken to people without telling them the situation that I'm in, and nothing irritates me more than someone who says, "Oh, my boss was all over me for months, and I was getting really down, and my doctor put me on Paxil, and within a few weeks I was feeling better, and now I'm off Paxil, and everything's great again." And I feel like saying, "Why the hell isn't that me?" I've been on Paxil twice, among several others, and none of them have really had this overarching, wonderful, positive effect. So, it's you want to set your expectations when you are prescribed a medication, and this is where one of the tips I'm going to leave with you later is patience. Patience on the one hand, because depending on the doctor you have, I think it's a fair statement to say most family physicians are surprisingly familiar with your basic run-of-the-mill mental illnesses, anxiety and depression in particular, because their practices, believe it or not, from what I've been told from more than one family physician, are anywhere from 40 to 60% of their visits are related to that. Not broken arms, not inoculations, but mental illness. So they see it an awful lot. And therefore, my guess is if you speak to your physician honestly, you're likely to walk out of there with a script, a prescription for something. So I'm going to very highly generalize here. But I think it's fair to say with antidepressants, which frequently do work. I mean, that's why the pharmaceutical companies have come up with them, because there's so many of us out here in society that need something. They take typically upwards to 6 weeks of daily dosage consumption before your doctor is going to call it, so to speak, as to whether or not this particular dosage or this particular drug is actually working for you, because your metabolism and your brain chemicals and structure are unique as to mine. So what may work for you may not work for me. Damn it. But nonetheless, so you need to have patience to stick with it. And the other thing you need to have patience for, as I just referred to, is you may not have the right med. And there is no test your doctor can run, to my knowledge, to find out exactly which antidepressant is right for you. So it's very much trial and error. So if you're talking about a 6-week timeline, they may put you on Paxil, which is one of the most commonly used ones, tomorrow. And they're not going to take you off it in all likelihood unless you have some adverse reaction, which I don't believe is typical with Paxil. It's a highly refined SSRI, and I'll get into what that means in a moment. But it does take a good 6 weeks to see if you notice a substantial difference. And then if you see a minor difference or none whatsoever, depending on your doctor, they may decide to, well, let's play with the dosage now and wait another 4 weeks or whatever. And then what may happen is they may decide, okay, this isn't the right drug, I want to try this. However, you've got a bunch of Paxil in your system. Not all antidepressants fall under this scenario I'm building here, but most do. We need to flush out your system. So now you need to stop taking it for about 2 weeks at least. Prozac is another very typical scenario. It needs to be flushed out of your system before they dare give you another antidepressant. So patience, my friends, patience. You do have to work with your doctor and understand the biology of all this stuff. So let's talk about two main categories of antidepressants. There are others. I'm not a pharmacist. I'm just talking again from experience. SSRIs, I believe, are the most commonly used ones. And what those 4 letters stand for are selective serotonin reuptake inhibitors. Selective serotonin reuptake inhibitors, SSRI. I debated whether or not to go into the details of what the heck a reuptake inhibitor is, but in the most simplest of terms, you may have heard of a brain chemical called serotonin. It facilitates, among other brain chemicals, the way in which electricity or neurons actually move through your brain. And your brain is not one continuous piece of tissue. The channels within your brain, the synapses, shall we say, are actually sort of built like this. And you notice this little gap in the middle? Well, they don't move like that, okay? From this end to this end, they have to jump this little gap. And in order to do that, there are chemicals on the tip of the outbound side and on the inbound side. And serotonin plays a huge part in how well an electron, I'm just calling it that, or a neuron, is going to actually fly through one part of your brain and then make that jump to the next part. And of course, this is replicated billions and billions of times every day, if not every hour. So if the chemicals that are there to sort of like push off that neuron and then on the receiving end receive the neuron effectively and keep it going, then that jump is not going to occur well. And so serotonin levels in particular are often looked at as a potential cause for depression, anxiety, all sorts of mental illness things. So if it makes you feel any better, it's actually physical in nature. It can be seen under a very powerful microscope, in all likelihood. Unfortunately, you can't put a cast on it and walk to work. So it's, for the general population, what you and I are facing is an unseen illness, and one which is greatly misunderstood unless you're dealing with a coworker or a friend or a family member that has experienced mental illness themselves or knows someone who has. And of course, a lot of us are somewhat self-conscious with respect to the stigma affiliated with that. And we'll have an episode on the whole stigma thing and the socialization part another time. But anyway, that's what an SSRI is. And there are gobs of drugs that are built, and probably with every passing year, there are more of them available on the marketplace to be prescribed. So they can be highly effective, both for anxiety and for depression. Now, going back a few decades, the first type of antidepressants that came out, and I don't know when exactly, I'm going to ballpark it in the 1960s, maybe a bit earlier. They were known as MAOIs. And I hope I'm pronouncing this correctly, but that stands for monoamine oxidase inhibitors. So I guess they get the first two letters from monoamine, MNA, and oxidase inhibitors is the OI, so MAOIs. One psychiatrist who put me on one variety of this, called Nardole, told me that they, in the medical community, they refer to MAOIs these days as dirty drugs. Only in the sense that when they first came out, there were huge side effects. They were not very well refined. When I was put on Nardole some years ago, it did seem to work for about 6 months, and then it tapered off and really didn't. With all antidepressants, depending on which one you're talking about, be it SSRIs or these ones or SNRIs or whatever else, side effects can include weight gain very frequently, a lot of water retention. They can include, in the case of MAOIs in particular, some very dangerous ones. For example, MAOIs can spike your blood pressure extremely fast based on your diet. So for example, when I was put on Nardole, I was told no red wine, no tomatoes, certain kind of cheeses, many of which, when I got to the pharmacy and read the literature, I didn't even recognize these cheeses. I don't eat them. I'm sort of a plain Jane cheddar kind of guy, but and a variety of food types. And the reason is that there's a particular type of, I think it's an enzyme, that triggers or interacts with these MAOIs, and they spike your blood pressure. So I was told many times from day one was that if I encountered a severe headache, like migraine level, that came up on very rapidly, get myself to the emergency room. Don't go to your doctor, go straight to the hospital, because in all likelihood the reason for the headache is an out of control rise of your blood pressure. And there were a couple of occasions when I went, but my blood pressure really wasn't that high. I just happened to have a headache. But anyway, red wine was the big one that you had to avoid. White wine was fine. So you have to be aware of the literature when you are prescribed these. Your doctor, in all likelihood, will explain these. Other side effects that you will have possibly is a lack of energy, sluggishness, lethargic behavior, typical stuff, but your body does adjust to those. So those are short-term ones and certainly not life-threatening. But weight gain typically is definitely the big one. So just to recap on the two biggest categories, we have our SSRIs, our selective serotonin reuptake inhibitors, and examples of that are Prozac, which is probably the best known one. It's been out the longest. It got a lot of media coverage when it first came out. Paxil, and then about a dozen others. And they have very few side effects other than weight gain. And then the oldest category, but it's sort of, like I said, the heavy hammer of the bunch, at least that's the way I looked at it, the dirty drugs, are the MAOIs. And examples of that, the most common one is Nardil. And that's the one where the side effects definitely can be quite severe, and you have to keep an eye on it. But as I said, with all of these, you have to have patience, and you have to take these things as they are prescribed. Other medications that you likely will be surprised prescribed may be symptom masking type of meds. Tranquilizers is probably just the best term to use. There's a wide variety of these sorts of things that are out there, particularly for anxiety. They do, especially if you've not been on any, they can relieve the immediate symptoms of anxiety attacks, panic attacks, or just generalized background anxiety like I have, fairly effectively. If you're able to take this type of tranquilizer on an as-needed basis rather than, say, 4 times a day, like I do every day, then wonderful. If you're able to have hours at a time where you don't have these feelings of anxiety, that, God bless you, I wish I was you, then that is the best route. However, your doctor may say, take these 4 times a day. Once in the morning, once at lunch, mid-afternoon, and once before bed. And it's not because they just immediately take effect, although that's often how it feels. It's because for the longer acting ones, they actually remain in your system on an ongoing basis. So just because you take the pill right away, even though they tell us it's not going to have an immediate effect with some of them, I find they do. The reason they're spread out, of course, is because we don't want it to overdose you, put you to sleep. But some of these, if they're heavy-duty tranquilizers or long-term ones, then they're intended to be pumped into your system 24 hours around the clock. So that's the way they go that way. There are some minor tranquilizers. The best known one is Ativan. Little teensy weensy pill that you would think is a speck of dust, and did nothing for me. You put it under your tongue, you let it dissolve, and it's a very fast-acting anti-anxiety tranquilizer. Now, I've got a friend of mine who is twice my size, and he also suffers from a similar type of mental illness. He can only take half of one, and he hates taking them because it puts him to sleep for 2 days. I, on the other hand, could probably take 4 or 5 under my tongue and get a minimal effect for maybe an hour. So Ativan for me just did not do the trick. A major tranquilizer, more of a long-acting one, the types that you don't necessarily take as needed, although that would be nice. Ones that are more long-acting are ones such as Rivotril, or the generic name where I live is clonazepam, and that is the drug I referred to in my first video. It's the only one that has provided me with any relief whatsoever, so I could go about my day and remain functional and think straight and remember things. Those are some of the side effects to the particular type of anxiety that I have. So, the downside with the tranquilizers, however, is your body gets used to them. And this is why I say take them as prescribed, naturally. But, you know, we all have the danger, particularly if we're isolated, and I'm in this spot right now, and I've been there before, that you just want out. You want an escape. You want to take a pill and you want it fixed, and that's it. Thank you very much. So there is a tendency with some people to mix these with alcohol, which is highly dangerous. Though I have done it, I will admit. There is a tendency to take more than the prescribed dose, although you'll find yourself caught at the end when that bottle is empty and you call your pharmacy for the refill and they say, oh, you're calling 5 days early and we don't refill this type of drug prematurely. And then you go 5 days with nothing. That is not pleasant. I have been there. So avoid that at all costs. And this is where you really have to watch yourself. And this is really, really hard. And hey, I will be honest with you. I have been there. I was there as recently as Friday, the day I put up my introductory video. Because I want a span of time in my day, my waking day, to just, for God's sakes, get a break from what I'm going through. I took all my meds at once, the whole day's worth. Not the antidepressants, because they don't have any immediate effect. My tranquilizers. I'm supposed to take 4 clonazepam a day, and as well as 2 Rivotrils, which are not really tranquilizers. They're often used for blood pressure control, but nonetheless, they do have a calming effect physically on your body. I took them all at lunchtime, the whole day's worth, and it barely was able to put me to sleep. Now again, I've been on these meds for over a decade, and I'm at the second highest level of dosage allowed. So, you know, I know exactly what's going on. My body's used to it. I'm hooked. I'm a drug addict, sadly. But so anyway, long story short, you do need relief, but you need to be strategic in the way you're doing it. Or going back to my earlier point, patience, patience, patience. Go easy on yourself. Don't try to duck and run. You can't do it with anxiety and depression. In fact, if you're really, really low, you don't have the energy for it. You don't know what to do. And that's why I'm making these videos. Anyway, one area of my history that I know I need to keep an eye on, over and above paying attention to the dosage instructions from my physician, is augmenting that with other I don't know if this is a word, sedative drugs. The easy ones to get are Gravol for nausea, antihistamines for a cold or a flu. I can remember times when I, had maxed out my dose of clonazepam for the day, just desperate to get, please God, 60 to 90 minutes of a nap in the middle of a day. Whatever it took, it didn't matter. And I would go to the pharmacy every few days and buy boxes of Gravol, antihistamines. It didn't matter to me anymore what it was. I just had to take it. Now, this is while I was out on long-term disability, so no one was waiting for me at work. But I'll remember one particular day where my body had built up such a resistance to these, and I was probably putting myself in a fair amount of danger. I wasn't mixing these with alcohol, thank God. But there was, the time of the day came where I was doing this, not the time of the day. I missed the entire autumn of 1 year, about 6 or 7 years ago. I spent it entirely in bed from September almost right up to Christmas. And it was 90% all the medications the doctor had given me, plus as many over-the-counter drugs as I could get my hands on, because I just wanted to escape. And sleep was my best friend. And I remember sleeping throughout the day in my son's bed. He had a cozy little room at the time in the house we had. And my wife picked up the kids and brought them home. And they were no older than 6 and 4. And they came up to the room and say, hi, Papa, how are you doing? And all this type of thing. And I woke up and I really wasn't that sleepy. And this is how long I've been going on with these, variety of medications without telling my doctor. My body was so used to them, but nothing but gibberish came out of my mouth. I mean, I sounded worse than drunk. I sounded like blah, 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 blah. The thoughts were forming in my mind perfectly clearly, or I thought so, but whatever the heck was coming out of my mouth, it sounded like I'd just been to the dentist. The kids were scared. My wife called the doctor. He said, don't worry about it. But of course, she didn't know why I was sounding like this. But I probably scared the heck out of my kids and my wife. And so anyway, long story short, don't go there. Don't even start down that path. It's a very dangerous one. And, let's face it, for a lot of us, this can happen at a time where you just don't care. You don't care if you wake up, and that's sad. But it's the reality of when you get into these really low ruts. Anyway, enough about me on that topic. Okay, let's wrap this up. Because this is pushing 30 minutes and I'm really trying hard to keep these under 30. So we've talked about what I'm guessing is likely to happen when you get help, professional help from a physician. You're highly likely to get a prescription. So you're going to follow the directions on that prescription, whatever it may be, or prescriptions to the letter. You're going to not only take it as prescribed, and yes, I'm looking at a few cheat notes here, but you're going to give yourself some patience, okay? You have to enter the doctor's office with the belief and the understanding that in all likelihood, this is not going to get fixed like a cold. This is going to take weeks, if you're lucky. So don't disappoint yourself in advance, okay? So give the drugs a chance and find some other ways to cope. And for some of you, if you're like me, a lot of these are going to sound very touchy-feely, wishy-washy. I'm going to shave my head and become a Buddhist monk. But I'm at the stage now where I've learned these things do honestly help, but they also take time. But taking time isn't a bad thing. I mean, if you're homesick, if you're on disability like I was, and not needing to go to the office every day, you still need to fill your day. Otherwise, you're just sitting there thinking and thinking and thinking, and it's just driving you insane. I mean that as a pun, please. So, you're going to be kind to yourself. You're going to say, you're not crazy. I'm not crazy. I'm not a nutcase. Okay? I'm here on YouTube. That's more likely to make me a nutcase than it is the fact that I have anxiety and periodic depression. I'm going to be patient with myself. I'm going to listen to my doctor, and I'm going to follow the instructions. And I'm going to explore some additional coping options, which your doctor may or may not suggest to you. Some doctors are very pill-based. They believe it's a physical problem, which usually it is, but they don't go for the psychology side. But nonetheless, I think most doctors would agree on some basics. Exercise, for one. Go for walks. If you're a jogger, go for a jog. I don't care how depressed and tired you feel or you can't get out of bed. One of the best things you can do for yourself is go to bed at the same time every day and get up at the same time every day. Even if you don't need to or feel like it, do it anyway. It maintains your body's regular clock. You've heard of that inner clock that we have. You need to stabilize the physical nature of your body. Once you're up, and I don't care when you do this, get some exercise. My insurance company, from when I was on long-term disability, paid for a local hotel's membership for the use of their pool. And that's one thing a lot of us don't know, is you don't have to join a gym. You don't have to join the Y and put out money out of your own pocket because you may not be able to afford it. If you happen to enjoy swimming and you don't want to be stared at by a bunch of people, like by lifting weights or being on treadmills or whatever, I mean, do anything. I don't care. I happen to choose swimming. And they paid for the membership. So that may be something you want to explore with your life, not your life insurance, your long-term disability insurance provider. Who knows what they will do. It's in their best interest to get you better if you fall into that scenario. So definitely exercise. It gets the physical energy out of your body. It's mentally healthy for you. It promotes, all the good stuff that we already know about staying physically active. And there's lots of enzymes and chemicals that are released in your brain because of exercise, and those can be highly beneficial to counteracting your anxiety or depression that you're dealing with. If you're willing, able, have the money, or have the coverage or benefits, or it's suggested to you by your doctor, I don't care if it's suggested or not, I think it's a wonderful thing, a therapist. Now, depending on what country you're listening to me or watching me from, where I live, we call them psychologists. You want someone accredited, someone that can say, I'm Dr. So-and-so, ideally. They can be social workers. Again, from my first video, in your community, I'll bet you anything, there is a mental health center. They may be an excellent resource, possibly for free or covered under your medical insurance. Or your government medical insurance, where they have psychologists on staff or a social worker on staff. But the bottom line is you have someone trustworthy and trained that you can talk to in an environment of trust. You don't have to worry about that stigma, because let's face it, they talk to people like you and me and worse every single day. That's what they're paid to do. And they went into this industry of theirs because they have a passion for helping others. I mean, why else would you want to sit in your desk all day long listening to people like me? If you didn't, you would just subscribe to my channel and just listen to me for 30 minutes. I mean, but why would you want to do it all day? Heaven's sakes. But having someone, as I said, professionally trained that you can just talk to, and they can ask you guided questions because they know what you need to spill. And it's not about going back to your childhood to find out what your mother didn't say or how your father didn't love you or whatever, though in some scenarios that is worthwhile going through. It's about dealing with the now. What is going on today in my life? And how do I move forward positively so that at some future point you will either come through it stronger, or if you're like me, you'll come through it with it, but able to live as full a life as possible, even though you still struggle with depression or anxiety. And they may have workshops, they may have group sessions, in addition to one-on-ones. So, speaking with a professional for an hour a week, even, I personally find, because I continue to do it today, exceptionally beneficial. And when they recommend things to you like meditation or self-awareness or being conscious of your thoughts, relaxation techniques, breathing techniques, please don't do what I did many years ago, which is, that's for the flakes of the world. I just need something hardcore. Give me the manual with the 10 steps to getting better, and I'm good. Thanks. Those other things, I believe, in combination with medication, in combination with working with your physician or your mental health professional, they all fit different pieces of the puzzle together over time. But you need to be committed to it. Otherwise, it's just not going to work. And that's probably been one of my biggest roadblocks along the way, is maintaining that commitment to myself, because I love myself, because I'm a good person, I'm a good father, I want to provide for my family. I don't want to exist, I want to live. And unfortunately, it's taken a decade for me to realize that drugs alone, in my case, are never going to do the trick. So there we go. Those are your tips. Be patient with yourself and the meds. Stick with the instructions on the meds, and explore other options, coping options, the exercise, the talk therapy, the breathing techniques, meditation perhaps, and maybe some suggested reading that your health professional can provide to you. There's lots more I could ramble on about, and will, in other episodes, but I really was anxious. I was really excited to get our second episode up on YouTube. So thank you so much for your time. I really, really hope that my story and experience, as unaccredited as it may be, is of some help to let you know that you are not alone and you don't need to be. So anyway, I believe somewhere in your screen there is a like or dislike button somewhere, as well as a subscribe button somewhere. I'm on a Mac, so mine are in maybe a different place than yours. I've been checking on the first video every day. Haven't had a lot of hits on it, but I didn't expect a ton at the beginning. But I can at least notice who's viewed it. But anyway, I do plan on continuing this series as often as I can. And even though I've rambled on now for pushing 40 minutes, I do hope to be able to tighten them up and make sure they stay up on YouTube so that you can go back and refer to them. And just remember, this is an adventure. Think of it that way. This is not a curse. This is not punishment for being a bad person. You are not crazy. You are a human being that is highly valued, and you deserve a chance. And in this society, we need to stick together, and sharing your story with another person can be exceptionally beneficial, which is selfishly part of why I'm doing these videos as well, for my own mental adventure. Anyway, you have a wonderful day, and watch out for episode 3, which should be up on YouTube within the next few days, if not sooner. Thanks very much for watching. Anxiety and Depression Adventures. I'm going to remember my own title. And you just have a fantastic day. See ya.